issue. Of course, this time around it has to be part of government's social responsibilities to the citizens, and you will agree with me that the vulnerable members of the citizens usually are women and children. But today we shall be focusing on children, the underage especially, who appear to have been neglected in the society, and probably as a result of that have found themselves in some kind of situations. Hence, the federal government decided to put up an institution, an agency, at-risk children program, which is a federal government program with the sole aim of bringing back some of these children into the mainstream of good life. Some of them are out of school, some of them, even though they are into some other informal means of getting education, such as the Quranic education, but many of them have derailed as well. Then we also have the category of drug addicts who have become so addicted to drugs and have derailed from the real sense of situations in life. And at-risk children program is aimed at capturing most of these children with the aim of bringing them back to proper lifestyle. And this morning I have with me some of the officials of the at-risk children program, the state program, at-risk children program, and we shall be looking at all of this. How has this program been kickstarted in Niger State, and to what extent has it been able to influence many of the children who are targeted to be captured under this program? And to discuss this matter this morning, I have with me first Mohammed Liman, who is a safeguard officer of the program, and then we also have Umar Usman, who is the communication officer of the program, at-risk children program. Other members of the team who we are likely to be expecting also include Hajia Aisha Matani, she is the gender officer, and then we also have the team coordinator in person of Hajia Umar Tafida, who may likely be unavoidably absent. But again, right now we have two of the officials, and we are going to kickstart the program. Gentlemen, you are welcome to the program.
Thank you.
Thank you so much.
Thank you so much. Okay, let me start with you, Mohammed Liman, the safeguard officer. What necessitates the idea of mooting a program like this at federal level, and then every state is mandated to domesticate such program?
Good morning. As you earlier introduced, we have the variables and the communities in our societies. So that necessitated the program, as we need to streamline them into the society so that they will have a meaningful life. And that is what necessitated the program. So, and the federal government say it didn't fit for the program, to come up so that these children and like of these children, will have a meaningful life. So a lot of programs were, arranged to streamline them back to the society.
Now that every state has been mandated to domesticate this program, how far have we gone in Niger State?
Thank God to His Excellency, former Governor Omaru Bago, for taking the bold step, to kickstart the program. Though the program started before his tenure, but he saw it as for the program Niger State to be able to, readmit the vulnerable children back to the society. So the program was kick-started. We did a lot of advocacy visits to the agencies that are partnering with at-risk children, because it has about 7 pillars, and those pillars cut across basic literacy and numeracy. We have health and nutrition. We have health and nutrition. We have entrepreneurship, financial literacy, incentivization. We have agriculture, climate change. We have sports, because that will give them a good sense of belonging for them to come back to society because of the lack of childhood that they didn't have. We have digital skills because as the world is going global to digitalization, we also were trying to inculcate them into for them to have digital skills. So these are the line programs we have for them. So, and we have agencies that government agencies that have this mandate to do them. So we've done advocacy visit to them, and the way we strategize to go by this program for the first phase, because we have what we call 3-11-11, because Niger State is 25 local governments. So when you pilot, you need to pilot with a little number so that you'll be able to perfect the program since it's coming in first time. So we have Chanchaga, Paiko, and Boso local government as our first phase of the pilot, which is the 3 local government. Then we'll go into another 11 local government. Then the last one, another 11 local government to cover the 25 local government. As we said earlier, we're targeting the vulnerables, which are out of school children. We have the almajiris and even the drug users, because we're targeting from the age of 4 to around 25-26 year old. So is covering most of the people who find in these categories, are in this age bracket. So those are the people we are targeting, and this is the scope we have now. Though we have trained these 3 local government, we train facilitators. We have hubs in each of the local governments. So we have about 22 hubs now we have. So we've trained about same amount of facilitators which are going to stay in these hubs, where they've been trained on how to impact these 7 skills we talk about to these vulnerable children and the young adults that we are targeting. So
okay, even though we are going to come back to some of those skills that you have just highlighted now, but let me come to Madam Umar Usman, who is a communication officer. How do you intend to source for your, do I see student, clients or pupils? How do you intend to source for them? Where do you go to look for them? Who are the people you intend to contact so that they can help you in sourcing for some of these vulnerable children?
Okay, thank you so much. Given that already the state has a substantial number of vulnerable people, and those people have already been identified. Before the commencement of the program, already assessment has been conducted, and these beneficiaries already have been identified throughout those assessments. However, during our advocacy visit, we are in collaboration with traditional institutions, local government authorities, and all this, like he has earlier mentioned, relevant agencies already that are dealing directly with these children that are, have direct linkage with the program based on our pillars. So ideally, already we have already identified them based on the analysis that was conducted and assessment. So we already have we have positioned them, already mobilized them, because currently we are already in partnership with Nike, and Nike has granted us about 1,000 slots. Some of our members already have been enrolled into Nike healthcare contributive system. So based on the assessment, our beneficiaries have been targeted. Okay,
you want to add something? Yes.
Okay, yes, I want to add something. The state have a variable register database with SOCO. So SOCO is giving us addition, because most of these data need to be validated, but still yet, some of the variables are getting out of the basket and some are coming in. So with that, addition to what he said, that is how we keep mining, the beneficiaries. Though our target for the first phase is around 100,000 vulnerable children for the first phase. So as we go on, we'll be increasing the the target, because they are found across the state, and that's how we intend to go about, and that is where we source our data.
Okay, you have talked about training some of your people to handle the training.
Yes.
And you have just mentioned that your first phase will capture about 1,000 vulnerable people. Do you have the capacity to contain that number? Looking at the fact that you also mentioned about piloting the program with 3 local governments. I'm sure you are trying to be more careful so that things don't get out of hand as you move on. 1,000, isn't it too much?
No, it is not too much. You know, since we have partnership with other agencies, you know, each agencies play their role and their own part. Also we do coordination. Though we've trained them, within us we have experts, and we've invited some of the experts within the state, you know, to train these facilitators. And we're going to be going in to check them on how are they impacting this knowledge on them. You know, we have a MIA component, and even the safeguard component is there to should checkmate and see the compliance. Are they complying with the guiding principles and the rules and regulations and protocols given to them? You know, because these children are already vulnerable, so we don't want them to, you know, move from one stage to another of vulnerability. That is why we said you don't do no harm. Do no harm. That is the principle of safeguarding them. If you cannot make them better, don't make them worse off. So, but we have taken the mandate of getting them better, and we are going to get them better, because if we don't get them better, our society will be going, you know, down the drain.
So, in addition, just like you said, 100,000 is not too much. Giving, you know, whatever it is that, whenever there is a support from your principals, I don't think a number will be too much. He has already mentioned, with a full support of His Excellency the Farmer Umar Bago, I believe the number, given that if you look at the statistics in the state, I think 100,000 is a mega number out of the numbers of, you know, the
millions of children.
The millions of children that are you know, are vulnerable. And honestly, the numbers are becoming alarming. So it's for this initiative, you know, to see that these children are taken back to the society. Thank you.
Okay. Now he has mentioned that as others are getting out of the basket, they are also capturing others to bring them into the basket. Now you can see that we also have children who may not likely be captured, but are also vulnerable. I'm referring to those children who are attending the Tsangaya school. If you go to most of these Quranic school, you realize that many of the children are vulnerable. Some of them have to go and beg, some of them have to do some other things as means of survival, and then some of them escape from those schools and don't even go back again. They continue to wander around in the city and become a mess to the society. In an effort to make an expansion, since you are relying mostly on the data provided by other agencies, do you intend to put in your drag nets so as to capture some of these children in the Tsangaya school?
Well, thank you so much for that question. Currently, part of our mandate also is to carry a wide coverage assessment to see that